All right. Hello, everyone. Are you in the field of applied behavior analysis, ABA? Do you support the adult population? Are you looking and cannot seem to find the right literature or possible CEU to help guide you in supporting the individual you serve? Well, you're at the right place. Welcome to .T Mental Health Alliance, a.k.a. DTMHA. And thank you for choosing us in obtaining your CEU certification. I am your speaker, Shonda J., your BCBA. To obtain your CEU certificate, you must click the link attached and enter the 2 passcodes from this interview. In this podcast, we will discuss ABA and applying cultural practices with our expert, Naeemah Webb. After you finish this series, you will learn in-depth information about cultural awareness and how to apply these concepts specifically with the adult population and their caregivers. As mentioned before, we have Naeemah Webb joining us. So a little bit about Naeemah. She graduated from Lane College with a bachelor's degree with a focus on cultural diversity. In March 2021, our speaker obtained a certification as a courageous conversation about race practitioner with Pacific Education Group, and also obtained a certificate the following year as an Intercultural Development Continuum Qualified Administrator. For those of you who may not be familiar with what an Intercultural Development Continuum certificate entails, this certification focuses on deeply shifting cultural perspectives and bridging behavior across cultural differences, and is also achieved through an adaptation perspective. Our speaker has engaged in community leadership by becoming a membership chair for the Young Women Task Force of Greater Lafayette. I probably pronounced that wrong. Is it Lafayette?
Lafayette.
Lafayette. Thank you so much. And in this position, Naeemah created innovators that address citywide concerns related to diversity, equity, and inclusion, and utilize data to measure progress. Currently, Naeemah is a doctoral student pursuing American Studies with a focus of community development. So let's just say, Naeemah, you are extremely proactive and have a very extensive resume. I just gave our listeners just a little taste of your education and involvement regarding community leadership and teaching experience. So thank you so much, Naeemah, for joining us.
Awesome. Thank you, Shonda, for having me.
Yes. So if you don't mind, I will jump right into it. According to authors Bob Ficklin and Lee's peer-reviewed article titled Increasing Cultural Understanding and Diversity in Applied Behavior Analysis, the article states, I quote, proper education and training professionals of any cultural background can develop the necessary skills to treat and interact with consumers who come from outside their culture. Now, this article was published in 2017. Since then, the field of ABA has gradually evolved in providing literature and resources addressing how cultural awareness can be applied to our everyday practices. But this article is a great resource in providing BCBAs a comprehension of why increasing cultural awareness and diversity in the workplace is very important, and also how a diverse workforce in the field of ABA is necessary to support consumers with multicultural backgrounds. So my question to you, Naeemah, is there a difference between cultural responsiveness, cultural humility, and cultural competence?
Yes. Thank you again for having me in a space. I'm so excited to talk to your listeners today. That's a great question. But I want to start off by establishing a working definition of each term. So to date, there's not been one definition of each term, as definitions have evolved from multiple perspectives and research. Therefore, the definitions that I am offering up derive from multiple studies. So let's dig into cultural responsiveness. Cultural responsiveness is the ability to respond to the unique needs of an individual based upon their culture, or their cultural norms. Cultural responsiveness requires one to have the ability to understand cultural differences, recognize potential biases towards those cultural differences, and consider those differences in order to work effectively with individuals whose cultural contexts are different from one's own. Now, let's dig into cultural competency. Cultural competency is seen as the ability to comprehend, interact, and communicate with individuals regardless of their cultural background. Cultural competency includes an awareness of one's own cultural view, working at and developing positive attitudes towards cultural differences, and having a knowledge of varying cultural worldviews and practices. But I'll be transparent. I and a significant amount of folks in this diversity, equity, inclusion field, DEI, we have started to move away from using the term. For me, the idea of competency can set one up to have like a one-and-done approach to cultural competency. Let's look at the word competency. According to Merriam-Webster Dictionary, competency is the quality or state of having sufficient knowledge, judgment, skill, or strength as for a particular duty or in a particular respect. So the challenge with cultural competency is that it assumes that one can be quote-unquote competent in a culture, other than their own. So it is my belief that no one can ever be competent in someone else's culture because culture is multifaceted, right? Yeah. There are like many nuances and variables to culture. And in some cases, these nuances and variables are not fixed, they're fluid. Therefore, I have come to find cultural humility to be a more appropriate term. So, what's cultural humility? Cultural humility is a lifelong process that involves self-reflection and self-critique, whereby the individual not only learns about another's culture, but they're also willing to become humble enough to examine their own beliefs and attitudes and actions towards individuals with different cultural beliefs. So I want to offer up a cycle of cultural humility that I often defer to. Now, this entails 4 components. The first is awareness, becoming aware of cultural differences and the implicit biases that may be associated with this difference. The second is knowledge, a commitment to deepen one's cultural knowledge so that one can consider a matter from a different cultural lens. The third component is skill, the development of skills that will allow one to engage with an individual with a different cultural background in a culturally responsive way. And the last component is action, right? As Dr. Maya Angelou stated, when you know better, you do better. Therefore, this component allows one to put their knowledge into action with the end goal of being cultural responsiveness. Hope that makes sense.
Oh, that makes plenty of sense. And it's funny because I know there were times where when I first got into the field, which was like maybe 5 years ago when I first became a BCBA, and I would get individuals at the time when I worked with children who were African American like myself. So I just automatically assumed like, okay, they're black, I'm black, I got this in the bag. Not realizing so much deeper than the person's race. Like it's so much that comes into culture. So I'm so glad that you emphasize on a lot of those things. And you provided great information for our listeners, especially when supporting the adult population and also considering the context of the case. You have some individuals who are supported at home and their family is a caregiver. Then you have the context of an individual attending a day program where the caregiver is a team of direct support staff, or you have the individual that lives in a group home and direct support staff provide 24/7 support. I mean, these are just a few examples of the typical context a BCBA may encounter when supporting the adult population. Now, when you think from a culture standpoint, you're not only considering the cultural needs of the individual, but now you have to keep in mind what is the culture of the group home setting, the day program, or the culture of the home when living with the family. When working with the direct support staff, you have to dig even deeper and analyze, well, what is the culture of the direct support staff? And what is their perspective? So when supporting the adult population, understanding culture is a key factor in analyzing treatment strategies based on the cultural needs of the individual and also the context of how they're supported. So, Naeemah, my next question to you is, how can clinicians practice cultural humility during staff interactions or family interactions?
Yes, I love these questions. They're so juicy. Let's dig into it. So I would start off by saying that cultural humility is a way of life that takes practice, bravery, empathy, vulnerability, and a willingness to engage in courageous and crucial conversation. One has to keep in mind, as my coach Stephen Michael says, perfection is not needed, but consistency is a must. Clinicians can practice cultural humility by choosing to move through that cycle of cultural humility that I referenced earlier. That cycle requires a deep and consistent reflection. Awareness is the starting point. One has to become cognizant of the biases that they hold in the workplace, the very biases that lead and cultivate microaggressions, prejudice, and all kinds of isms that harm fellow staff members. There is a saying in equity that one cannot see what they're not looking for. Therefore, in order for one to stay within that cycle of cultural humility, they have to become aware of their blind spots. Again, consistent self-reflection will help with this. Conflict often brings an opportunity for one to become aware of their blind spots. For instance, during a conflict, one should listen to understand rather than listening to respond. You can do this by paying attention to a person's words, what's important to them, and not what you think you want to hear. Check your prior assumptions, right, with the information that you're hearing. Lastly, ask yourself, how do I know what I know? Is an early life experience conditioning me into an assumption about a similar but different situation? The practice of cultural humility involves viewing every encounter as a negotiation between two worldviews, yours and theirs. But it takes humility to be centered in your own worldview.
Yeah. And that is that is very important, very important. And when addressing cultural humility, how can clinicians or BCBAs teach their staff to practice cultural humility with the individual and their families?
That's good. Shonda, the most powerful teaching comes from modeling, right? One cannot effectively teach what they're not practicing. So my question would be, how are we treating our fellow staff members? How are we modeling a culture of care in our workspace? There's a real science behind this idea of caring. When we feel cared for, our brain is flooded with neurotransmitters and hormones like oxytocin, the same hormone that makes a mom fall in love with their baby, even after the pain and effort of labor. These quote-unquote happy chemicals tell our prefrontal cortex, the thinking part of our brain, that all is safe socially, emotionally, and physically. All systems are a go for learning. But what happens when you don't feel safe or cared for? It becomes challenging to learn in this state. The flood of stress hormones like cortisol divert blood from the prefrontal cortex and the amygdala in preparation for fight or flight. This is definitely not the time for learning. The brain will begin signaling to the individual that it's time to respond to threats. So in addition to modeling, clinicians can practice principles of cultural humility for staff by understanding and respecting different points of view and challenging both personal and institutional biases. Again, one has to be in a constant state of self-reflection. Ask yourself, what biases might be impacting your decisions about teams, priorities, and and resources? It's important to cultivate brave spaces within the workspace where you can have difficult conversations with staff and give and receive real-time feedback. This is inclusive leadership. And I want to note that I intentionally use the term brave space rather than safe space because there's no way of knowing what feels safe to another person, right? So in addition to modeling and cultivating brave spaces, practicing inclusive leadership, staff should be offered diversity, equity, and inclusion professional learning opportunities.
And I'm so glad that you brought up modeling because as BCBAs, one strategy that we encourage all the time when it comes to teaching a new skill is BST training, and that is called Behavioral Skills Training. It consists of 4 components, which is instruction, modeling, rehearsal, and feedback. So as a BCBA, it's one of those things where, like you said, we demonstrate those skills, but from a clinical perspective, especially when it comes to working with the adult population, you can provide your staff clear instructions And these instructions are not only for the staff, but make them relatable where you are applying them every day. Then from there, when you go and you're interacting with the individuals, you're interacting with the direct support staff, you use that as an opportunity to model what that may look like. That could be just checking in with the person. Also, just listening instead of you just assuming you know everything. And then rehearsal. Rehearsal is basically you just asking the staff to take the lead. Well, you know what? The last few times I was there with you, and I normally led the conversation. What I want you to do is I want you to take the lead this time. I'm actually probably just going to sit in the office, an earshot away, and just hear how everything goes. And then feedback, that is when you follow up, and then you give the person feedback on how they can improve and do better. And that's just one example. So in person, it could just be you providing them clear instructions. It could just be an email, maybe a text message. Hey, this is what we can do. Then from there, modeling in person while you're there with your staff, you kind of demonstrate what you expect based on the instructions. And then rehearsal, you just in the moment provide those opportunities beforehand. Like I said before, hey, I know we're supposed to meet with this family. If you can, we meet with the individual. You take the lead. Maybe you can have me on the phone with speakerphone so I can listen in, things of that nature. And then feedback, you follow up. And you can do the same thing virtually as well. And I know a lot of times when we think of virtual, we're just like, how can we do things from this context? But you can do it. Like I said before with the instructions, same thing, email, just something. It doesn't have to be very formal. It could just be, like I said, a text message. Then from there, modeling. You do a video call, and you let the staff know, hey, let the family know I'm going to sit in and I'm going to take the lead, so you can model to them what is expected. And then rehearsal, same thing. During that video call, you let the staff know, hey, you know what, I'm going to just sit back and listen. Better yet, I'm going to turn my camera off. And we're going to let the family know beforehand that's what we're doing, that you're taking the lead. That way I can provide you feedback later. And then make sure anytime you provide feedback, you do it immediately. And those are just some examples of how you can do it. And when working with the adult population, you can do that not only with the caregiver, which is the family, direct support staff, but also with the individual when practicing a lot of these techniques in regards to just cultural humility. And like Naeemah said, as a BCBA and as a human being, it all starts with you, because it's one thing for you to teach this with others when you're not practicing it within yourself. So my question to you is, how can clinicians – I think I might have said this question already. And I don't know if I'm jumping the gun. How can clinicians teach their staff practice cultural humility with the individual and their families? Did I say that one already?
Yes.
Okay, all right. Thank you, Naeemah. So for our listeners wanting to earn a CEU, our third CEU word is culture. CULTURE. Again, listeners, our first code word is culture. Now, another great article that aligns with the topic we are discussing is titled Cultural Humility in the Practice of Applied Behavior Analysis, published in 2019 by Patricia Wright. The article focuses on how cultural humility practices can be applied by engaging in self-reflection, questions on an individual and organizational level. The article mentions how self-reflection can be a great tool for reassessing private events and digging deeper to identify if you may be experiencing personal bias. And just in case for people that don't know what private events are, you have in the field of ABA, normally you have behaviors that you can see the person engaging in. For example, somebody tapping their foot, somebody maybe putting their hands on others, someone maybe engaging in verbal aggression such as yelling or screaming. And in private events, are more considered as like emotions, things that people are going through in their mind. Maybe they're having racing thoughts. Maybe they're feeling frustrated, things of that nature. The discussion notes for the article mention limited literature addressing personal bias. And with this podcast being published in 2023, there's still limited research addressing personal bias and application of ABA. So, Naeemah, how can clinicians incorporate culture responsiveness before the initial intake process.
Yes. If clinicians are actively engaged in that cycle of cultural humility, they can be more equipped to engage with individuals with multiple backgrounds. So if you remember that cycle of cultural humility, awareness, right? Building your knowledge, your skills, your action, so that you can put everything into action. And if there's a way to do a pre-intake where the potential clients share their demographics, doing so will allow clinicians to ensure that they have enough awareness, knowledge, and the skill to engage with clients of particular background.
All right. Yeah. I'm so glad you addressed that question. So when you're BCBA, specifically working with adult population, our clinicians, the majority of the time, you're always collaborating with the caregiver, supporting the individual. As mentioned before, this could be someone who's a formal caregiver, such as direct support staff or home health aide, and something we have in the state of Delaware are shared living providers. These are considered caregivers. And this is basically someone who shares their home with someone and they provide that person care. Then you have the more formal, such as family, spouse, family, friend, etc., when it comes to caregivers. Now, when working with the adult population is so much different as opposed to working with children. Normally with children, the parents have the final say, or legal guardian, and that could be maybe a child living with their grandmother or auntie or whatever, foster mom. But when it comes to working with adults, you're not really don't get me wrong, the active parties, which are the caregivers, you want to hear their voice, but when we're working with adults, you want to hear from the individual directly. You always need to hear from them directly. So when working with adults, you always have to prioritize the rights of the individual and how they want to be supported, while also keeping in mind you have to collaborate with the caregiver as well, who is always providing support day in and day out. As an organization, what is the best way to teach culture humility to families who have loved ones receiving formal caregiver services, such as living at a group home, day program, shared living providers, etc.?
Yeah. So again, I have to say, I got to go back to that modeling. Through modeling, organizations can cultivate a space of inclusion and belonging. One way to model cultural humility, and especially to help grow a family's awareness and knowledge, is to celebrate inclusion and cultural heritage through uses of a diversity calendar. Each month, your organization can send out a communication which highlights cultural holidays and or cultural awareness themes that reflect the diversity within your clientele and staff body. For instance, we are in the month of June. A significant amount of diversity calendars refer to June as Pride Month. If your organization did undertake that idea, you could write up a blurb that wishes your clientele community a happy Pride Month and maybe a short description on why it's important to acknowledge the month on an organizational level, i.e. allyship or being a co-conspirator. In that communication, you could also share some resources that will allow interested families to learn more about the history of Pride Month. In the month of June, Juneteenth is also a significant holiday, which commemorates the end of enslavement for African Americans. With a holiday such as this, you can also share resources about the history of Juneteenth. And as an organization, you want to be intentional about centering and highlighting cultural heritage and celebrations that have been systematically pushed into the margins of our larger society. If capacity allows, your organization can take it a step further and have a diversity wall, in your group home or day program or any shared living space that is intended for families. This could also be a way to engage clients if you allow them to help co-create the material that will go on the wall. So if your program allows family visits, I will place the diversity wall in a space where clients and family can see it. So that's just some examples.
So how can we teach practicing culture humility to someone who is very novel or unfamiliar with the topic?
That's a good question. So in order to teach practicing cultural humility to someone who's new to the topic, you must start by bringing that which is unconscious to their consciousness. So, starts with self, right? Before anyone can dig into cultural humility, they have to be clear on their attitudes, thoughts, and beliefs. They must begin to unpack their own identity, cultural values, and beliefs. So this process could be facilitated through a restorative healing circle or even a book study, just to name a couple of methods. For instance, in a book entitled Racial Healing Handbook, Practical Activities that Help You Challenge Privilege, Confront Racism, and Engage in Collective Healing, the author talks about the importance of knowing your racial identity and exploring your racial identity. The author gets readers to reflect on their earliest memory of race in the moment when they realized that they had a racial identity, right? So the author has readers reflect on what their family and or life experiences has taught them about race. I share this because the same approach can be taken when speaking to someone who is new to cultural humility. Let's think back on that cycle that I shared, right? It starts with awareness, then knowledge building, then skill building, and then action. One cannot gain an awareness of others without first thinking about culture and the impact that it has on one's life and the lives of others.
Yeah. So how can we identify if we lack cultural humility? And I know this sounds pretty redundant to the last question I just asked, but what about someone on the team lacks that cultural humility? And so how do we address this with ourselves or with the team member?
Yeah, no redundancy at all, just a different lens. And that's a great question. There are many ways to access the lack of cultural humility within an organization, right? So one way is if you notice that certain groups of people remain underserved. This may be because services are inaccessible. For instance, let's say the organization is in a working class community, but only offers services from 9 a.m. to 5 p.m. Monday through Friday. This will make it difficult for folks to access services as there's no after-work hours. Another sign is if you find a pattern of certain racial groups not staying in treatment. This may be indicative of the fact that those individuals may not feel understood, and the way that they explain their problems might not be seen as valid. Or perhaps they do not want to do the quote-unquote talk therapy as it's not valued in their community, and a problem-solving approach would be better received. Another factor of assessment could be a high turnover rate with a specific racial group, especially when you think about BIPOC staff, Black, Indigenous, people of color. Staff retention is fundamental in this work. For each staff, turnover necessitates a retraining. And lastly, you can assess the lack of cultural humility by tuning in to the staff's thoughts on cultural responsive related training. So, to be honest, if these trainings feel like pulling teeth to the facilitator, then you may want to unpack why that is so. And especially determine the staff's level of interest in learning about other cultures, just to name a few ways.
Yes. And what you can do as a BCBA in your practices is just that naturalistic training. And I know normally when we think of naturalistic, working with the kids, you're just thinking, hey, I'm playing with them outside and I'm using this as an opportunity to teach a skill. Or, hey, I'm walking with them in the hallway in school. I'm using this as an opportunity to train and teach a new skill. But when it comes to work with the adult population and your staff members, a lot of the things you mentioned could just happen in casual conversations with your staff. Literally, you guys, after wrapping up a one-on-one, you have those conversations. Hey, if you notice that they're free, you check each other's schedules, see when you guys are free, and just make it a point that you spend 30 minutes just to debrief on these things. That way you don't feel it's an obligation to have these formal meetings all the time, because the reality is, as BCBAs, our caseloads are very expensive. And if you can just naturally just kind of throw in them trainings when you can, it will really help you kind of constantly teach the skill without it seeming overwhelming, trying to make it very formal. And also you can send emails too, emails and text. I'm very good with that. I always encourage that being a resource. So I had a experience with the case where the family encouraged the individual, who was an adult male receiving services, to use sexist remarks towards the women that were supporting him. And the family also encouraged the same individual to touch the women inappropriately. So what advice would you provide BCBA and BCBA clinicians in practicing cultural responsiveness to a case working with the individual who illustrates cultural views that contradict your own beliefs, or they are in an environment that has different or may feel inappropriate cultural values? Like, how can we distinguish between cultural values versus personal bias, personal views?
Yeah, that's a hard one. Unfortunately, we live in a world where family is not always the best influence, right? James Baldwin states, we are trapped in our history and our history is trapped in us. For those of us who grew up in the traditional family structure, the familiar cultural lens is often how we viewed the world and came to know it as appropriate, to know what's appropriate, what's not appropriate. This is the way that the lens that we use to view the world, right? There were so many familiar ways that I had to unlearn, which did not serve me in the community that I sought to build. And it sounds like this may also have been the case with the example you gave with the client. So if a situation similar to this presents itself, I would assume that whomever is serving the client has built somewhat of a relationship or a rapport with that person. I would encourage the staff to lean in on that relationship to engage in a crucial conversation with the client. I would get clear on the client's intentions. For example, what I heard you say was ... Is that accurate? If the client upholds the inappropriate or problematic personal view, I would share the impact that that comment had on me, or the impact that it can have on a person who looks like me or shares a similar cultural background. I would say something like, the impact of the comment that you just made could be ... Is that what you intended? I'd really like to learn more about why you said what you said. In order to help the client not go into defense mode, I would acknowledge their perspective by saying something like, given what you shared, I can understand why you hold this view. Point. Thank you for your honesty. So that, that curiosity-based inquiry may help sustain the conversation. And as the conversation deepens, I will share some crucial feedback, such as, though, if you choose to, make these comments or conduct yourself in this manner or touch women without their consent, it can create a barrier for your service, right? Just leaning into that relationship, helping sustain the conversation. People don't know what they don't know, and sometimes it just takes one person to shed some light on a perspective that they never considered or never had to consider, for that matter. There's a possibility that the client may uphold the problematic view, but it's important to at least plant the seed of possible change. Someone else might come along and water that seed or fertilize it or what have you, but just know every action that you take matters. It makes a difference.
Now, I'm actually going to use that myself.
Yes.
I'm going to use that myself, yes. So before accepting a case, should a clinician, our BCBAs, ask about the individual's demographics, such as their race, ethnicity, things of that nature? If so, once they receive that information, how should they move forward with the consultation process?
Yes, it's important to make space for clients to share their demographic information. It is especially important to learn about the individual's cultural background and history so that the clinician can make room for intentional engagement. In order to engage in cultural humble and cultural responsive practices, the clinician has to be aware of what demographic they will be serving. It's important to know the impact of that culture, race, and ethnicity has had in the lives of whom we wish to serve. You have to truly be able to see a person before serving them. And when I say see, I'm referring to the experiences that they're entering in with based upon their demographic. You cannot see a person without first learning how their intersectional identities, when you think about intersexual identity, think about race, how it intersects with gender, how it intersects with ability, how these intersectional identities have been impacting their life. For instance, the stress of code switching and the need to assimilate is quite different than the general stress of work and school. Knowing how a person is entering in should help shape the clinician's approach with the client. You ultimately want to create a safe space for the client, and you cannot fully do so without understanding the nuances of their identity, right? So once the clinician learns about their potential client, I would engage in a culturally responsive line of inquiry to learn more about what approach may work for the client, what expectations they have for their service. Therefore, the clinician can assess if he, she, or they are a good fit.
All right. So, Naeemah, we are at the point where we're wrapping it up. And based on your area expertise and your personal experiences, do you have any additional information for our listeners that should be addressed in regards to this topic?
Yes. I really enjoyed engaging in the discussion, so thank you again for having me in this space. Thank you, listeners, for staying engaged, so I appreciate that. I would lastly share that cultural humility. I want to stress that, like the idea, because I know we live in a society that talks about being competent, and it often, as I said earlier, fosters this one-and-done approach, right? And so to get change, we have to be culturally humble, just to acknowledge that we don't know everything. Always be open to being in a state of learning, right? And cultural humility requires clinicians to learn from cultural diverse clients and empowers clients by allowing the clients to be experts in their own culture. It involves careful listening and reflection, and this is a lifelong work. Therefore, when engaging in this work, it's important to have self-compassion. Remember, no one is perfect. Have grace for yourself and have a commitment to remain consistent. Remember, perfection is not a requirement, but consistency is a must. Willingness is a must. Remember, there's skill gaps and there's will gaps. Skills can always be developed as long as you have the will. So thank you again for having me in the space.
Yes. No, thank you, Naeemah. Thank you. Thank you for listening, for all of you out there. And just so you're aware, and you've all been waiting, our last code word to earn your CEU, the second word is humility. HUMILITY. We should all practice humility. Now, to earn that CEU certificate, you will have to click the link attached, and then from there you will access a survey where you will submit the 2 code words. And then also, too, the literature that we discussed in this interview is also attached as well. Now, if you're a BCBA listening to this and supporting the adult population, share some of your experiences regarding cultural humility or how you can utilize some of the things discussed in this interview. Even share with us some future topics you would like to be discussed. Now, when it comes to YouTube, you can put that in our comment section, or if not, you can just let us know in that survey of how you feel like this can be inputted in your daily practices. Now, do you want more information about how to support the adult population as a BCBA? Remember to subscribe to our channel so you can continue to get more information and resources. Our mission as DOT Mental Health Alliance is to help you succeed by working together to identify ways to create a learning environment for change. Until next time. Bye.